So my watch is now 3 minutes past 12. So I suggest we start this this lunch webinar, and I would like to welcome all the audience, the attendees to this lunch webinar. I'd like to thank the Swedish Society of Medicine for organizing this, especially Elinor Smith. But most of all, of course, I would like to welcome Professor Benjamin Lebwohl, longtime colleague and friend from Columbia University in New York. And just a few words about Ben, who has a perhaps an unusual background, but it's not unusual given the topic of today, because you majored in medicine while being a graduate at Harvard College. So you really, I know you have a very strong interest in medicine. I also know that you play music yourself, only superseded by your own kids, I would say. That's at least my impression. And we have a joint background in our interest in celiac disease and gastrointestinal disorders, where you trained at the Mailman School of Public Health. I know with Al Neugot, who's also a famous epidemiologist. You published a great number of papers, more than 300. I'm not sure whether you're still the director of the Celiac Disease Center at Columbia, but you are a professor of medicine at Columbia, and have a strong interest, as I mentioned, in celiac disease, and I would say also endoscopy and other GI disorders. I also know from your junior colleagues that you're well known for being an excellent tutor and teacher. But today we're moving over to Ludwig van Beethoven, which is the topic of today, and I'm extremely happy, Benjamin Lebwohl, Columbia University, to have you with us. Please, the scene is yours, Ben.
Thank you, Jonas, my longtime collaborator and friend, and thank you to you all for dedicating some of your time during your weekday to this topic. This is a little bit of a different topic. It's a medical talk about a towering musical figure, and his bust is shown here, Ludwig van Beethoven. My undergraduate years I spent in college at Harvard. Shown here is Payne Hall, which is the main concert hall. I played in the student orchestra, and you can see on the proscenium up on top the names of composers. And it starts with Bach, and then it proceeds, or Monteverdi rather, it proceeds chronologically, and then the greats are in the front. And it's not a coincidence that Beethoven is in the center, where all eyes are on. Beethoven really has a singular place in European classical music tradition. This is partly because he not only was a beloved composer in terms of his music, he very much redefined the genre, and he redefined multiple genres of music: the string quartet, piano sonata, the symphony. These were all irrevocably changed by Beethoven's musical output. But he not only changed the genres of music, he also redefined our notion of the artist. Back in the days of Haydn, the artist was the servant of the nobility. He was very much in the employ of the Esterhazy family, for example. Beethoven was a freelancer, and he also was not seen as the servant of anyone. He was his own man, and he was a revolutionary. He was someone who everyone knew suffered, and he was seen as a hero. This is the typical portrait you'll see of the master, right? And this notion of the artist as angry and suffering very much carries forward. And you can see in the 20th century this iconic photo of or portrait of Jim Morrison, right? So the artist as brooding as suffering. This very much comes from Beethoven. Some believe that the size of the compact disc also comes from Beethoven. There's some debate over the provenance of this story, but the traditional story goes that when the executives at Philips and Sony were trying to decide how large should the compact disc be, well, the consensus was it should be large enough to play Beethoven's Ninth Symphony, which, according to the iconic recording, was 74 minutes long. And so the compact disc is this size and not bigger and not smaller, because it needs to hold 74 minutes of music, which is one performance of Beethoven's Ninth. Beethoven's Ninth premiered 200 years ago, and just a couple of months. So it premiered in this building, the Kartnerter Theater in Vienna. It's no longer standing. It's where the Hotel Sacher now is standing in Vienna. And we have eyewitness accounts from this piece. Even though it was in his late period and many of Beethoven's later pieces were so out there they weren't appreciated, Beethoven's Ninth was very much appreciated. It was a big hit at its outset. And an eyewitness writes, at the end of the symphony, Beethoven stood, turning over the leaves of his score, utterly deaf to the immense applause, and Unger, who was the soprano, the singer, pulled him by the sleeve and pointed to the audience, whereupon he turned and bowed. In other words, Beethoven, basically sitting in the front row, was unable to hear the rousing ovation that he received. Someone had to tap him. Someone had to pull his sleeve and say, turn around and take a bow, because by then, Beethoven was all but completely deaf. And so I'm going to try to talk about Beethoven's medical life. He has been the subject of fascination for both musical lovers, but also the medical community, because of the fact that the extent to which his deafness affected his life and his music. If I could recommend one reading from this lecture, I would recommend Beethoven, the Music and the Life by my mentor, Professor Emeritus Lewis Lockwood. He really weaves the music and the life in a way that biographies rarely are able to do. And so I will draw upon biographical sources and also letters. Beethoven was a prolific letter writer, as were most 19th century arts figures, but also conversation books. Now, conversation books are unique to Beethoven studies. When Beethoven was unable to hear in his conversations, he had these books that people who would visit him would write in. And so we have hundreds of pages of books where people are writing conversations, and we don't have Beethoven's response because Beethoven would speak and then other people would write. So it's sort of like hearing someone who's on the phone. You only hear half of the conversation, but it makes for fascinating detective work. We also have medical histories, both contemporary to Beethoven and subsequent to his life. Here's the first letter that we have on record from Beethoven. It was sent when he was 16 years old. He had gone to Vienna in hopes of meeting Mozart and falling under his tutelage, but then he had to return home because his mother was deathly ill, and in fact, she did turn out to die from tuberculosis, we believe. He was writing to a friend with whom he had stayed in Augsburg and was apologizing for an unpaid debt. He wrote, "I must confess that from the time I left Augsburg, my pleasure began to run down and my health along with it. Since I've been here, there have been few pleasant hours for me to enjoy. The whole time I've been affected by asthma, and I'm afraid it could lead to tuberculosis." And so from the first letter we have on record, we have Beethoven talking about his health. Respiratory problems here. Tuberculosis loomed large in Beethoven's family. His brother also had died from tuberculosis at a very young age. At age 25, we have an account from a contemporary Beethoven, a friend of his. He wrote, it was only 2 days before the concert that he composed the rondo. This is for his second piano concerto. And that, moreover, while gripped with rather severe abdominal pains, which he frequently suffered. Gastrointestinal complaints figure prominently in contemporaneous accounts of Beethoven. In 1801, having established himself as the exciting young artist in Vienna, he writes to his old friend, Franz Wegler. Now, Wegler and Beethoven were childhood friends in Bonn, Germany, and their paths diverged. Beethoven setting out to be a composer, Wegler became a doctor, pursuing his studies in medicine, but they stayed in touch. And Beethoven had just completed and published his first set of string quartets, and they were well received, but Beethoven had a secret that he was not ready to share with the public, but only to his friend Wegler. He wrote, You should know that the noblest part of me, my hearing, has greatly deteriorated. Even when you were still here with me, I felt signs of this and said nothing. But now it has grown steadily worse. Whether it will still be able to be cured remains to be seen. Please keep this matter of my hearing a deep secret, and don't tell anyone, no matter who. At the theater, I must lean right on the orchestra to be able to understand the actors. When I'm some distance away, I can't hear the higher tones of the instruments and singers. I've avoided society completely, for I can't bring myself to tell people I am deaf. If I had some other profession, then it wouldn't be so bad. But for my profession, it's a terrible thing. And then he comments likely about tinnitus. My ears continue to buzz and ring night and day. Beethoven is able to conceal these symptoms, not telling the musical public, for it would impact his professional advancement, but he feels the need to confess this to his close friend. A year later, we have the Heiligenstadt Testament. This is perhaps Beethoven's most famous non-musical composition. This is a letter that he wrote while staying in the northern suburb of Vienna, Heiligenstadt. It's a letter that he wrote addressed to his brothers, but he never sent it to them. This letter was found in a desk drawer in Beethoven's Vienna apartment shortly after his death. He clearly kept it for many years, for more than 20 years, waiting for it to be found by the public after he died. In it, he confesses the extent to which his hearing loss drove him to despair, but what he decided to do with this despair. He actually gave a sort of medical release. He'd been seeing a Dr. Schmidt, and he wrote, "If Dr. Schmidt is still alive when I die, please ask him in my name to describe my illness and to attach this page to the story of my sickness, so that as far as possible, the world will become reconciled to me, after my death at least." And actually, if you go to Heiligenstadt today, there is a Beethoven museum. And in it, you can see the ways Beethoven tried to compensate for his hearing loss, for how he tried to adapt. He had this large hood that he kept on his piano, and he would lean his head under the hood so that the sound would be captured there and reverberate. He would bang on this piano so he could hear his best, the best that he could. Ages 45 to 48 in these intervening years were characterized by multiple respiratory infections, continued bouts of abdominal symptoms, and progressive deafness. It was during those years that he began to use the so-called conversation books. And here we learn medical advice that he was given by his doctors. Here's one. Specifically, you take fresh horseradish, just as it's pulled out from the ground, and grate it onto cotton cloth, which is quickly rolled up and stuck in the ear. This must be repeated as often as possible, always using fresh horseradish. So maybe not the most sound medical advice, but medical advice nonetheless. In 1821, we learn of bouts of rheumatism, and he writes in a letter, "I've been constantly ill from the last year to this. And the whole summer long, I too have been seized with jaundice. That went on until the end of August. I had to go to Baden in September, but because it was cold in that neighborhood, I came down with such a bad case of diarrhea, I couldn't continue the cure and had to flee back here again." So again, we're learning about gastrointestinal symptoms, and then for the first time, the yellowing of the skin, jaundice. Age 55, he writes to a doctor, "I'm spewing out quite a bit of blood." This is either hemoptysis or hematemesis, probably only from the windpipe. Even more of it pours out my nose, so epistaxis, which has happened frequently this winter, perhaps a coagulopathy. And again, he writes, "No doubt about it, my stomach is terribly weak." And then during a severe illness, when he is perhaps at the brink of death, he is visited by his physician, who writes the following in a conversation book: "No wine, no coffee, no spices of any kind. Every fever lasts a little while. Yours is already going away." Beethoven then responds, saying something, we don't know what, but the doctor writes, "You have a strong tendency to inflammations, and it wouldn't have taken much more before you would have gotten a right good intestinal inflammation." Beethoven says something, and the doctor responds, I'll bet if you take something alcoholic, in a few hours, you'll be lying there weak and worn out. Beethoven doesn't fully recover, and he spends about a month or two with his brother in Gneitzendorf, near Vienna. There he deteriorates medically, and he returns to Vienna, feeling worse. And on the ride back, it's quite a harrowing ride. An eyewitness account writes, because of poorly prepared food, he would eat nothing but a few soft-boiled eggs at noon, but then would drink wine all the more, so that he often suffered from diarrhea. As a result, his belly had gotten bigger and bigger at the end, which led him to wear something to bind it for a long time. We then have a detailed eyewitness account from Dr. Andreas Wawrich, who is the final doctor who took care of Beethoven during his last months. Wawrich writes in his memoirs, he was laid sick and feeble in a wagon and finally arrived in Vienna, exhausted and spent. I found him afflicted with the most serious symptoms of pneumonia. His face was burning. He was spitting blood. Suffocation threatened his breathing. On the 8th day, I found him stricken and suffering from jaundice over his entire body. The most dreadful vomiting and diarrhea had threatened to kill him the night before. From now on, dropsy began to develop. Now, dropsy is a commonly used term in the 19th century medicine, referring to life-threatening edema, right? So this could refer to organ dysfunction, heart, kidney, or in this case, liver. The amount of urine voided was sparser. The liver showed clear signs of hard nodules. The jaundice increased. We then learn of a procedure that was performed then, just like in many ways, it's still performed today, but perhaps with a few modifications, a large volume paracentesis. By the 3rd week, nightly attacks of suffocation appeared. The enormous amount of accumulated water required quick treatment, and I felt it necessary to recommend an abdominal incision, a tapping, to prevent the danger of sudden rupture. After a few moments of serious reflection, Beethoven gave his consent to the operation. The chief surgeon made the tapping with his usual skill, so that Beethoven, happy to see the water pouring out, called out that the surgeon reminded him of Moses, who struck the rock with his staff and brought forth the water. So a therapeutic paracentesis. Of course, we don't hear anything about sterilizing the area or applying rubbing alcohol to the skin before the incision, which actually may be clinically relevant in this case. He continues, the amount of liquid weighed 25 pounds and the afterflow was surely 5 times as much, perhaps an exaggeration, but clearly a large amount of fluid. A fierce red erysipelas-like inflammation appeared, displaying the first round patches on the skin, but careful drying of the incision's borders held the trouble in check. So a successful large volume paracentesis, perhaps leading to a localized infection. This was not the only one he had. He had serial LVPs, as we call them. December 20, January 8, February 2, and then February 27th. This one was complicated by a persistent leak. This is a phenomenon that has the eponym Flood's syndrome, named after Charles A. Flood, the first gastroenterologist at Columbia University, where I practice. We know that he had Flood syndrome because it was written in a conversation book. The maid will put a wooden pail under the bed so the water won't run in the room. Finally, when it was clear that this was really only a temporizing measure, his doctors relented and agreed that he could be palliated with alcohol. This is a sketch of Beethoven on his deathbed. His final days were characterized by waxing and waning orientation. He completed his last will and testament. And then on the day of his death, a case of wine appeared. It was delivered, sent by an admirer. He looked at it and he said, "Pity, pity, too late," or at least according to one biographer. And with that, he became unresponsive and died later that day. Shown here is Vienna at Beethoven's funeral. Beethoven's death was a big deal. The schools were closed that day. He was not an underappreciated artist. He was surely seen as someone who gave in to many eccentricities in his later years, and many of his later works were not appreciated at the time. But he was still regarded as the greatest composer of his time. The composer Schubert was one of the pallbearers at his funeral. There was great interest in Beethoven's, not just his music, but also his health, the cause of his death, and the cause of his deafness. And so we'll focus on really these first two illnesses that we know about, that we know that Beethoven suffered from. We'll focus on the hearing loss and what sounds like cirrhosis. In terms of what could have caused his hearing loss, when thinking about a differential diagnosis, some potential causes are shown here. Perhaps recurrent infection. He certainly had headaches, meningitis-like illnesses. It sounded like it was sensorineural deafness. There was a question of, could he have Paget's disease? The shape of his head perhaps implied that. Could he have an immune-mediated hearing loss, perhaps in the context of concurrent inflammatory bowel disease? And could he have sensorineural otosclerosis, given the chronicity, time of onset, and progressive nature? As for his cirrhosis, what about alcohol use disorder? There is, I would say, fairly compelling supporting evidence. It is the most common cause of cirrhosis in most populations. He did have a family history of alcohol use disorder. His father was known to be a heavy drinker. He definitely drank alcohol, particularly wine, daily. We know this from his day-to-day encounters, but that's a difficult one to ascribe as a sign of alcohol use disorder. Some would argue that wine was safer to drink than water in Vienna in the 19th century, given contaminated water supply. But key to this potential diagnosis is the fact that Beethoven continued to drink alcohol despite worsening symptoms and despite warnings from his doctors. He was also prone to wanderings. He would walk around Vienna and frequently get lost. One night, he had trouble finding his own apartment, and he was knocking on doors late at night, and the police were called. They picked him up and took him to the station. And even though he insisted that he was Beethoven, the police didn't believe him. And only when a friend identified him and took him home did they let him go. Certainly, Dr. Wawrow, his final doctor, believed that Beethoven had a drinking problem. He wrote, never being accustomed to take medical advice seriously, he began using alcoholic drinks to stimulate his waning pleasure in eating and to take long, fatiguing walks to give little relief to the weakness of his stomach brought on by overindulgence in strong punch and ices. There appeared to be this dynamic that Beethoven had with his healthcare providers, a dynamic that we sometimes see today, where a patient is using alcohol to palliate or treat symptoms that the doctors believe are actually the effect of excessive alcohol intake. Beethoven was a celebrity when he died, and anatomic pathology was really starting to get off the ground in terms of modern pathology. We know so much about pathology in general because of Karl Rokitansky. So Rokitansky figures in this story. He's considered one of the fathers of modern anatomical pathology. He pioneered en bloc autopsy dissection. He observed 60,000 autopsies and performed 30,000 of them. His first autopsy was when he assisted Dr. Johann Wagner on Beethoven. And so this was Rokitansky's first of 60,000 autopsies, Beethoven's autopsy. We have the written report. We do not have photos or histology of Beethoven's organs, but my colleague at Columbia, Dr. Jay Lefkowitz, has recreated them with comparable organs that fit the descriptions. So here they are. In the cavity of the abdomen, 4 quarts of a grayish-brown turbid fluid were effused. The liver appeared shrunk up to half its proper volume, of a leathery consistence and greenish-blue color, and was beset with knots the size of a bean on its tuberculated surface as well as its substance. All its vessels were very much narrowed and bloodless. A cirrhotic-appearing liver shown here in cross-section, and perhaps under micrograph you can see these large fat droplets. Steatosis and perhaps steatohepatitis, and shown here in a trichome stain, abundant fibrosis. The spleen was found to be more than double its proper size, dark-colored and firm, so splenomegaly. The pancreas was equally hard and firm, its excretory duct being as wide as a goose quill. And then it goes on, we see that There was shrunken kidneys. Overall, the body was very much emaciated, so cachexia. Shown here, Dr. Lefkowitz, my colleague, illustrated what a goose quill might look like. And so he had a firm or hardened pancreatic duct, a thickened duct. This is a sign of chronic pancreatitis, and we can see calcium deposits in this representative photo of the pancreas. What about his deafness? Well, there was interest in there, and so here's some perhaps relevant description. The facial nerves were of unusual thickness. The auditory nerves, on the contrary, were shriveled and destitute of neurona. The accompanying arteries were dilated to more than the size of crow quill and cartilaginous. The left auditory nerve, much the thinnest, right? And so it appears that there is atrophy of the eighth nerve. And you can see in this drawing, perhaps it's relevant that the eighth nerve comes here, right at the base of the skull. And so meningitis can cause scarring at that area and a progressive sensorineural hearing loss, particularly pyogenic meningitis from Haemophilus influenza that can cause a basal meningitis, or Streptococcus pneumococcus that can affect the convexities over the sagittal sinus. Shown here is a pyogenic meningitis. And so could it have been a severe infection, which we knew about, characterized by fever and severe headaches that Beethoven had in his 20s, that then resulted in progressive scarring? There was also interest in these other potential diagnoses: otosclerosis, Paget's, neurosyphilis, right? So I must say that examination of the external and inner ear, not very revelatory with regard to these diagnoses, but bony overgrowth characteristic of Paget's disease was not observed. And so here's my colleague's summary. In general, there was cachexia and jaundice. There were 2 liters of turbid ascites. Ascites, when present, is ordinarily straw-colored and clear. And if it is turbid, that implies infection. So he either had spontaneous bacterial peritonitis, which happens in cirrhosis spontaneously, or postparacentesis, secondary bacterial peritonitis, due to the non-sterile nature of the instrumentation, the large volume paracentesis that he had during the last months of his life. He had micronodular cirrhosis with steatohepatitis consistent with alcohol abuse. He had congestive splenomegaly, chronic pancreatitis, and chronic meningitis with eighth nerve atrophy and demyelination left greater than right. There was no evidence of Paget's disease or otosclerosis on examination of the bones. Shown here, just in case anyone is wondering, what about syphilis? For every famous 19th century person with medical mysteries, particularly composers, syphilis is often invoked as part of the differential. This is a characteristic appearance called hepar labatum, which was not observed in Beethoven. So unlikely that Beethoven had syphilis, or at least unlikely that syphilis contributed to his liver illness. And so that was, I would say, the medical consensus for many years. And then in the year 2000, there was this question of lead intoxication. And actually, this led to a popular bestseller called Beethoven's Hair. And this was because there was a lock of hair that was analyzed and found to have high levels of lead. The journey of this lock of hair is a story in and of itself. But briefly, it was popular for the equivalent of the selfie today, to take a selfie with a celebrity. Back then, you would take a lock of the person's hair. And after Beethoven died, many celebrity or fans would come to his apartment and snip a lock of hair, including Ferdinand Hillier. And he gave it to his son, Paul, in 1883. And this was then given to Dr. K. Fremming in Denmark and passed to Dr. Fremming's daughter, Michelle Larson. And it was then, the lock was then auctioned to a urologist in the United States at Sotheby's for 3,600 pounds. And on the lock of hair on the case, it says, "This hair was cut off of Beethoven's corpse by my father, Dr. Ferdinand Hiller, on a day after Beethoven's death, that is March 27, 1827, and was given to me as a birthday present in Köln on May 1st, 1883, signed Pearl Hiller. Shown here is the lock of hair. Now, this is not the only lock of Beethoven's hair floating out there. There are a number of them, but this was the hair that was tested. And you can see what was described here, not peer-reviewed, but published on the media as a press release. Opiate levels in the lock of hair were undetectable. Mercury level also undetectable, but highly elevated levels of lead. So lead would potentially explain multiple disparate signs and symptoms. Where could he have gotten lead poisoned? Well, leaded decanters in the alcoholic beverages. He would go to medicinal spas and mineral water had lead, and his doctors may have been giving him lead as a treatment, that we don't have direct evidence of that. There are plausible symptoms lead could cause. It can cause mood disturbances, abnormal liver and kidney function, so-called lead colic or abdominal pain, and even hearing loss. It fits so well. It's so tempting. But this was then disproven most recently in March of 2023, when the first peer-reviewed publication from the Beethoven Genome Project was published. And so this project involved analyzing 8 separate locks of hair that were attributed to Beethoven. 5 of those locks of hair were genetically identical. The other 3 were disparate. The Hiller lock, the one that showed the high lead levels, turned out to not to be Beethoven's. It belonged to a female of Ashkenazi Jewish descent. So it was basically a forgery. So not Beethoven's hair. Beethoven's genome, though, was sequenced, and he was found to be a compound heterozygote for the HFE mutation, which is involved in hereditary hemochromatosis. And so though he unlikely had the full-blown hemochromatosis phenotype, the authors postulated that he may have been more susceptible to any insult to the liver, including alcohol, as a result of this genotype. Interestingly, the presence of hepatitis B virus was also found on one lock of hair. Now, whether hepatitis B was circulating in 19th century Vienna at the time is still a subject of debate. The first known sexually transmitted outbreak of jaundice was only reported years later in the 19th century. And this is a PCR analysis. So whether Beethoven had chronic hepatitis B remains, I would say, disputed. And then most recently, this past year, the lead story comes back, because the confirmed locks of hair, the genetically identical locks of hair, were tested for lead, and there were elevated levels of lead there too, and also elevated levels of arsenic and mercury. Now, first of all, testing lead on hair is really only an indirect measurement of internal lead composition. The other comment I would add is that initial story about lead turned out not to be Beethoven's hair. So if elevated lead was found in this random person's hair and on Beethoven's hair, one might conclude that actually lead on hair in any environment was very, very common in 19th century Europe. And so it's not clear that Beethoven was particularly different from his contemporaries. And so it would be hard to invoke lead as causing Beethoven's deafness and other illnesses. I add this latest entry from the Beethoven's Genome Project, particularly because these investigators include investigators from the Karolinska Institute in Sweden. They looked at the polygenic risk score that had been established for musical ability and beat synchronization, and looked at Beethoven, wanting to know how he would score. And Beethoven only scored in the 9th percentile, at least for beat synchronization. All that is to say, and the authors rightfully conclude, beware polygenic risk scores, especially when extrapolating to different environments. right? If Beethoven had undergone a genetic aptitude test for musical ability based on what we know about genetic determinants of music score, he would have told maybe he should choose another profession. And so this really mandates a humble take on any behavioral polygenic risk score. So back to the Beethoven Museum. So when I visited, they had this slide. It wasn't really Beethoven's hair, but the Beethoven Museum in Vienna really went all in on the lead theory. In fact, so much so they talk about that as the cause of death, and they do not mention alcohol. And I was struck by this because anyone with a medical background who reads Beethoven's Autopsy, it's clear as the noonday sun that he had cirrhosis, and it's very unlikely that this was lead, much more likely that this was alcohol related. And so William Meredith, a major Beethoven scholar, wrote this commentary a few years ago about called Diagnostic Challenges, Best Sources and Future Paths for Diagnoses of Beethoven's Physical and Mental Illnesses. And he basically mandated this. He said, the most productive future research should be conducted by medical researchers working with Beethoven musicologists with a deep knowledge of all the biographical sources. And so this is something that sort of bothered me, and I wanted to know, like, why is alcohol underplayed in Beethoven museums and Beethoven biographies? And why does the general public not know about this? So together with a very talented medical student at Columbia, we reached out to Professor Meredith, and we invited him to collaborate with us on a sort of comparative literature study where we would compare Beethoven biographies to medical articles about Beethoven with regard to how much was alcohol mentioned and focused on when considering Beethoven's final illness and death. And so what we did is we searched PubMed for any article about Beethoven, and there are plenty, and we compared them to books and treatments of Beethoven from general biographies. And my mentor, Lewis Lockwood, his most recent book came out, I think, in 2020, called Beethoven's Lives, is a fascinating study of biographies. It is the history of biographies of Beethoven. And so we looked at each of those biographies, and we wanted to know what percentage of these biographies mention alcohol as possibly contributing to Beethoven's final illness and death. And so we compared general biographies to medical articles. This was published about 2 years ago, and we found that there was significantly greater use or greater mention of alcoholism or alcohol use disorder in medical articles compared to general biographies. Both had mentioned alcohol consumption. Sure, you can't talk about Beethoven's life without mentioning alcohol, but in terms of alcohol as a possible cause or alcohol use disorder, medical articles were significantly more likely to mention it than general biographies. And so we presented this 2022 at the American Musicological Society, New Orleans. This is really interesting. They had a full day all on Beethoven, and you can see, just like medical conferences, they really go all in on various aspects of Beethoven's life and contemporaries. And so we concluded in the presentation, alcohol as a cause of Beethoven's death was more commonly invoked in medical articles than biographers writing for a non-medical audience. To me, what was most revelatory, I mean, one learns a lot spending a day with the Beethoven scholarly community. It was wonderful. But what really sticks with me was the question and answer period, because there was really a great debate. Are we underplaying, are we downplaying the degree to which Beethoven drank too heavily? And one of the directors of the Beethoven Museum in Bonn, Germany, raised her hand and said, when I first started out at that museum, and I was trained as a tour guide, I was told, don't mention cirrhosis when talking about Beethoven's death. If someone asks, you can mention it, but don't get it out there. In other words, there's stigma still attached to chronic liver disease and cirrhosis. That really, I would say, conveyed to me the general sense that because of that, and because it sort of belies Beethoven's heroism, that it's been underplayed. And I think we need to revisit that. Finally, in the closing minutes, just to little bit on why there's so much interest in Beethoven's illnesses. You know, you type Beethoven's deafness into PubMed, you get more than 100 articles and all sorts of conjectures. And I would flip the question around and ask, do Beethoven's illnesses have anything to do with his music? And in one of the sketches for his middle string quartet, Opus 59, number 3, he actually writes, "Let your deafness no longer be a secret, even in art." Some believe that's his way of saying he's finally going public with his deafness and can't hide it anymore. But others believe that maybe Beethoven tries to portray deafness in his music, or tinnitus at least. And indeed, in the late quartet, his final quartet, Opus 135, there is one moment that actually sounds like it could be sudden, brief, unilateral tapering tinnitus. Back to the Heiligenstadt Testament. What did he write in that letter to his brothers? He wrote, "I have been brought to the brink of despair. Only a little more, and I would have ended my life. It is art and art alone that held me back. Yes, for it seemed impossible to me to leave the world before I have brought forth all I feel capable of." Beethoven was exhibiting suicidal tendencies when it became clear that he could no longer hide his worsening hearing loss. And yet he felt that he had so much more to do with regard to creating art, that's what kept him going. And so we delve into this. At Columbia, I have the privilege of teaching a seminar, an elective for fourth-year medical students, nearly about to graduate, about to get their degrees. And we learn about the connections between medicine and music. We study Beethoven's music, but we also study his illnesses. We bring in a string quartet from Juilliard, the local premier musical school in Manhattan. And what's really interesting is these are young, soon-to-be professionals, just like these medical students are young, soon-to-be professionals, and they have a lot in common. And they talk about professional identity formation, and they talk about work-life balance, and they talk about performance anxiety and being judged all the time, and the struggles with their profession. And so it's really a wonderful way for these people to interact. Finally, Beethoven saw music as healing itself, intrinsically medicinal. In his Pastoral Symphony, he writes happy and thankful feelings after the storm in his final movement. He ends it with saying, "Lord, we thank you." In his late string quartet, Opus 132, he labels one of them Holy Song of Thanks to the Divinity, from a convalescent, someone who's recovering from an illness. Antonia Brentano was a close friend and possibly love interest of Beethoven. She would have frequent bouts of illness or depression and would take to bed for days at a time. Beethoven would visit her, sit at the piano, play, and then leave without saying a word. She writes, "He visits me often, almost daily, and then he plays spontaneously because he has an urgent need to alleviate suffering, and he feels that he is able to do so with his heavenly sounds." Beethoven saw music not only as his way out of despair, but also as intrinsically medicinal. Thank you for your attention.
Thank you so much, Ben. This was extremely interesting and stimulating. So I will open up for questions from the 50 or so participants. If anyone, either you raise your hands or you just write in the chat, and we'll discuss the questions. While you think, everyone, I may have a few questions for you, Ben. So what about syphilis? Is that something you have ruled out completely? It is, otherwise, the great, what do you say, mimicker. I mean, it can show very many different signs, symptoms, and it was common clearly in this in these times.
Well, I'd say, Jonas, I can't say that Beethoven didn't have syphilis. It was very common. It was circulating rampantly in the 1820s. Indeed, Schubert, the pallbearer composer at Beethoven's funeral, likely had syphilis, according to most contemporaneous accounts. Beethoven likely frequented prostitutes. We know this because one of his early biographers, Anton Schindler, ripped out pages from his conversation books or edited them to try to cover this out. So it's very possible Beethoven had syphilis, but he never had the characteristic rash associated with secondary syphilis. He never had, as far as we know, the genital lesions associated with primary syphilis. And he didn't have ataxia or the other cardinal symptoms of neurosyphilis. So I would say there's really very little evidence that if he had syphilis, it contributed to any of his illnesses.
I mean, as a pediatrician with a strong interest in the GI tract, of course, I find it quite interesting with these suggestions that he would have intestinal inflammation. You know, he had diarrhea, he had liver disease, and both you and me were working on a project on celiac disease and liver disease. So what are the chances that he might have had celiac disease?
Well, so I wish I had a vial of Beethoven's serum, so we could check for tissue transglutaminase IgA. That would really tell us more than anything. He had wax and waning diarrhea. He had liver disease. This could be inflammatory bowel disease with primary sclerosis and cholangitis. It's possible. That's the leading suspicion by Anton Neumeier, who wrote a medical biography of Beethoven. He could potentially have celiac disease or irritable bowel syndrome, or he could have recurrent infectious gastroenteritis given the state of the water supply in Vienna at the time. Really no way to know. I would say that we could know if he had a genetic predisposition to celiac disease because we do have his genome. So we could know whether he had a compatible HLA type. But of course, having a compatible celiac gene does not mean that you have celiac disease. The great majority of people with HLA, DQ2, DQ8 end up not having celiac disease.
Are we aware of any composer who have suffered from such a handicap that deafness, I mean, has to be if you're a composer? Are there other composers with a similar deafness?
Yes. So Beethoven, I would say, was the composer that was most prominently, associated with deafness. But Bedřich Smetana, the Bohemian composer, Czech composer, famously also had deafness and portrayed tinnitus in one of his string quartets. It's not a not a common combination to be a deaf composer, but especially if the deafness is later on in life as opposed to congenital. Composers often, have their early musical training and so have a very detailed sort of inner musical life and have that component of the brain developed. There's a wonderful book called Hearing Beethoven by a musicologist, came out about 5 years ago. And the thesis of the book is that Beethoven's overall compositional output is intrinsically affected by his loss of hearing. And the resonances, particularly in his piano sonatas, are ones that he worked out while sitting under that hood and banging.
Here we have a question from Michael Levey. Thank you so much, Professor Lebwohl, for your fascinating lecture. What about tuberculosis? Were Beethoven's lungs examined at autopsy? Could his deafness have been due to tuberculous meningitis?
The lungs were examined and focal pneumonia was found. Not surprising, of course, in someone dying of cirrhosis and likely bacterial peritonitis to have a focal consolidation. The characteristic tubercles or nodules seen in pulmonary tuberculosis were not appreciated then. He, of course, had many reasons to have been exposed to tuberculosis. He was likely exposed as a young child or teenager. It was in his family. But I would say not confirmed on autopsy. He also may have had a hepatic hydrothorax. Many people with severe ascites requiring serial large volume paracentesis end up with pleural effusions. That might have been contributing to the so-called pneumonia that Wawr described when Beethoven first arrived in Vienna in his first final illness.
Okay, let's see. Do we have Philip Leon has asked here, thank you for a great talk. Could you elaborate a bit on the tinnitus that Beethoven had? For example, is there information on whether it was persistent or intermittent?
It's a good question. So whether it was constant or would come and go, we're not sure, though he did say, my ears continued to buzz night and day. He wrote that in his letter to Franz Wegler. That implies that it was constant. We also know he was very worried about the effect of loud noises on his hearing. When Vienna was being shelled by Napoleon's army I think it was 1807 or 1808, he famously hid in the basement of a friend in the cellar, and he put pillows over his ears, concerned that what little hearing he had left would be affected further by severe noises.
Okay, we have some more questions. Thank you for this wonderful presentation. Liver disease and especially liver cirrhosis are hugely associated with the stigma. Even me as a hepatologist, this is Juan Vaz writing, have at times a hard time finding other historical celebrities that have suffered from liver cirrhosis. Are you aware of other, celebrities suffering from liver cirrhosis, Ben?
Sure. Well, so in the musical world, Johannes Brahms died after having recurrent jaundice. He was thought to die from cancer, and they called it liver cancer. How certain we are that this was truly hepatocellular carcinoma as opposed to metastatic disease from some primary, we don't know. But yes, he likely suffered from liver disease. Outside of music, of course, there are some celebrities famously got liver transplants. Mickey Mantle, famous New York Yankee baseball player, got a liver transplant for hepatocellular carcinoma, and there was controversy there because it was thought that perhaps he was given priority because of his celebrity status. And I believe the cancer recurred shortly after his transplant, implying the possibility that perhaps transplant was not appropriate, that he wasn't necessarily a good candidate. Steve Jobs, of course, Apple's founder, got a liver transplant for a neuroendocrine tumor, a metastatic neuroendocrine tumor. But I agree, cirrhosis is often downplayed among celebrities because of stigma.
So I think this is our final. I'm now coming to. Well, we have two more questions, I think. Then, so from Klaus Chalien, thank you for an excellent talk to Lebwohl. Was there any heredity for deafness?
So it's a good question because certain causes of deafness, Alport syndrome, otosclerosis, often run in families. We have no documented evidence that anyone in Beethoven's family had hearing loss. I will say that the Beethoven Genome Project looked at other Beethoven families, relatives of his, and what they found was that there was one, what they call extra-paternal event, 2 generations above Beethoven. In other words, someone who was thought to be the father was not actually the father. And so this remains an evolving field.
Okay, final question. Is not tinnitus plus hearing loss a typical problem among musicians of all kinds?
Particularly, this is true, particularly in the modern age of amplification. So rock musicians will very frequently suffer from some degree of hearing loss and tinnitus, especially if they're not using earplugs at their performances. It was certainly less of an issue in the era before amplified sound in music.
Okay, thank you very, very much, Benjamin Lebwohl from Columbia University, and to all the attendees for joining us for this session. Before we close this session, I'd like to mention that tomorrow, the Swedish GP Society, SVAM, has a webinar about prescriptions. Then next week, my society, so to say, the Pediatric Society, has a webinar about child abuse, the Munchausen by proxy. Later on next week, we also have a webinar by gastroenterologist also from New York, Adam Fay, about IBD in the elderly. And after that, we have a meeting about tick-borne encephalitis. So as you can see here, we have a very active program in the Swedish Society of Medicine, and I thank everyone for attending this and other sessions. With that, I'd like to once again thank Benjamin Lebwohl and wish everyone a great day. Take care.
Thank you.